Thank you, Chairman, and thank you for a kind invitation. I've had the most wonderful welcome here in Northern Ireland, and it's just lovely to be here. I'm going to talk about my experience of setting up and managing a participation programme in Mersey Care Trust, which it's a large mental health trust providing health and social care services, and it's based in Liverpool. And hopefully, I think my role here today is to try and stimulate some ideas from my experience that you may find helpful in taking forward. And I'm going to begin, I think, by... Oh, I've gone too far. Where are we? Yeah, that's better, sorry. Okay. I'm briefly going to try and put what we did in Mersey Care into a bit of a context. And I have to say it was entirely unplanned, but I think it follows on reasonably neatly from what John Williams was saying before the break. But I pretend that I planned it, absolutely, and we spent hours in discussion about who's going to say what and how, but that's not true. Sometimes we're lucky enough in life to come across people who inspire us. And one of the people who has inspired me is Eleanor Roosevelt, who was the driving force in creating the 1948 Universal Declaration on Human Rights. I am quite old, I wasn't around then, but she asked, I think, a very pertinent question, which luckily she went on to answer. Where, after all, do human rights begin? In small places, she said, close to home, so close and so small that they cannot be seen on any map of the world. But unless these rights have meaning there, they have little meaning anywhere. Without concerted citizen action to uphold them close to home, we shall look in vain for progress in the larger world. And John was talking, I think, about how, in a sense, how the lawyers, in the sense of hijack the human rights agenda. And I'm sure getting international sign-up to human rights agreements must be so difficult, and it is just so important. But I think Eleanor Roosevelt was saying, well, unless we can actually make those rights real, close to home, in Northern Ireland, in Liverpool, then actually what value do those big major treaties have? So in the small places close to home. I was lucky enough to come over yesterday evening and have supper with some of the team from HNI and ARC who've put the event today on today. And I'd have to have a wooden heart, an absolute heart of stone, not to be inspired by the work that's happening here and the team are doing to actually make human rights a reality. I've got around quite a lot in my time on the human rights agenda, having been the national lead for a human rights and healthcare programme for the Department of Health. You have here a commitment to human rights that is a very rare, a very precious thing, and please, please nurture it, grow it. You don't know how important it is. Anyway, Mersey Care Trust. Closer to home for me. It was established in 2001, and I was very interested in what the Minister was saying about the complexity of care arrangements, because at that time in Liverpool there was the most amazing complexity of arrangements for mental health and social care. Previously, they've been provided by, I think it was 5 different commissioning, there were 5 different commissioning organisations involved and 7 different NHS trusts. Now, 2 or 3 social services departments as well. So if you can imagine trying to get anything done, it was pretty impossible. And the idea back in 2001 was to bring all of the mental health services together under one umbrella so that there would be a passionate and committed voice for mental health services in the city and the surrounding area. So Mersey Care was established to provide the local mental health, learning disability, drug and alcohol services for about 750,000 people in the Liverpool and surrounding area. And into that mix was added low, medium and high secure services, because Mersey Care provides Ashworth Hospital, which is one of 3 high secure services in England. So we're talking about a complex organisation, we're talking a multi-million-pound budget, we're talking over 70 sites providing inpatient, outpatient services, community services and so on. And so we're talking about bringing all of those services, 4,500 staff together under one umbrella. And you've of course got different organisations, you've got different cultures, you've got different histories, you've got different practices. And in a sense, as a board member, suddenly on April the 1st, 2001, you think, well, what on earth are we going to do to shape this organisation up? We've got this wonderful opportunity, then how are we going to move this organisation forward and bring it together? Because it's not just about merging policies, just having one policy instead of 7. I don't know about you, when you have change, in England we have lots of consultation events. And people go along. If we're talking about reorganising the health service, we have consultation events and everybody thinks, well, it's fixed anyway. I don't know why they're bothering to ask us. They've decided what they're going to do anyway. I don't know if that rings any bells over here. I'm sure it doesn't. But lots of service users and carers, people who use the mental health services, came along to those events. And again, I don't know if it's the same here, but in Liverpool, people kind of tell you how it is. They're not sort of shy in coming forward with their views and opinions, which is one of the reasons why I loved working in Liverpool, that lovely edge to things. But at the consultation events, there was such a clear message, which was basically, okay, you're going to reorganise this trust, you're going to give it a new name, but if all you're going to do is change the label over the door, frankly, we're not the slightest bit interested. We want a very different kind of organisation. We want an organisation that's going to listen to us, that's going to respect us, that's going to involve us in decision making as equals, that's going to respect our human rights, that's going to actually, in a sense, look at the provision of services that we're all in. I hate the phrase, all in this together. We have a common humanity here. Whether you're a member of staff, a manager, a service user or carer, actually, we are people, we are citizens. This is about citizenship. It's about changing the balance of power in health services that too long have been weighted very unequally. So, if I can, I've got to organise papers, mouth and screen. Not easy. Okay. So, why participation is important, fundamentally important in taking a human rights-based approach, which back in 2000 Mersey Care started to do. And it was a journey. You don't kind of change these things overnight. But back in 2001, Mersey Care really, I think, was the only NHS trust board that I was aware of that was actually spending time talking about human rights, about talking about what a human rights-based approach actually meant. And could we actually get the participation of service users and carers into the culture of the organisation? A bit like Blackpool Rock, wherever you cut it across this complex organisation, we should see that real participation of service users and carers in all the decisions. And I think that was a fundamental shift. Because there's always a lot of talk about participation and involving people, and the Department of Health sends these missives down and everything else. But often it's done in a very paternalistic way. We'll decide what you're going to be involved in and participate, what decisions we'll let you participate. We'll decide how we're going to do it. Yeah? And we usually do it by, we'll do it in two weeks because we've got a really tight schedule, so we'll do it over Christmas or over the holidays when actually nobody's really geared up to respond to consultations. We've all been there, haven't we? So I think it really was about turning that telescope around and looking at the issue of participation through a human rights lens and stopping diminishing service users and carers as passive recipients of care, and actually turning that telescope around and seeing people as people with fundamental human rights to participate as equals in all the decisions that affect their lives. And I think at that time we were unusual, and I hope things have started to move on. Why participation is important in health services, again, I'm probably telling you, I think, what you already know. In a sense, we don't leave our human rights at the door when we move in, when we go into hospital, or when we're in touch, as poor Marge did, in a sense, when we're in touch with health or social care. We deal in human rights issues in healthcare day in, day out during the week. And mental health services possibly are a little bit better at acknowledging the role of human rights in services than perhaps acute services are, because we have the Mental Health Act, we have legislation, and so we're used to discussions about right to liberty, deprivation of liberty, enforced treatment, and so on. And in a sense, there are some protections in the Mental Health Act which have come down from the Human Rights Act, which are there to protect people in touch with mental health services. But Mersey Care started to try and look at all of its work through a human rights lens. And I think if health services don't try and put on that human rights pair of spectacles and look at their work differently, it's not just about care, it's not just about treatment, it's not just about waiting times, it's not just about money and how we're going to make some cuts to meet the budget. We need to look at everything that we do through that human rights lens. If we don't, we know what can happen. We saw the Francis inquiry into Midstaff's Hospital, which I'm sure that you've read, where things can go badly wrong if we don't pay attention to people's human rights. Between 2005 and 2009, the Francis inquiry found a culture of appalling and unnecessary neglect at Stafford Hospital. Between 400 and 1,200 patients may have died as a result. We don't even know how many patients died as a result of patients left in pain, distress, hungry, filthy, and satisfying their thirst by drinking from flower vases. And you think, this is a modern NHS? This is best, world-class NHS? And the Francis, it might have been sort of at the far end of the spectrum, what was happening at Stafford Hospital. But you can be very sure that service users and carers weren't involved in decision-making there. And Stafford wasn't the only one. The Care Quality Commission report, I think 2010, the Alexandra Hospital, Redditch, where doctors were prescribing drinking water so that the nurses didn't forget. What? Only recently, Addenbrooke's trying to save money by stopping the provision of iced water. How much? You know how hot and stuffy hospitals are. You've had an operation, you want a nice cool drink, and you couldn't get a nice cool drink in Addenbrooke's until people kicked up an awful fuss about it. The Care Quality Commission, only in the last few days in England, 2/3 of hospitals are offering substandard care, 1 in 8 inadequate. So that's why participation is important. And I think the participation of older people in Mersey Care we saw as being particularly important. And again, these will be familiar reasons for you. Obviously, older people have mental health problems. The population of older people is growing. And older people are particularly vulnerable to having their human rights abused in mental health services and health services generally. Many older people are carers of other people using mental health services, so they've got an important stake in the kind of services we provide. And I think, I'd say most importantly, but very importantly, older people have such a huge amount of knowledge and wisdom that they can actually share and impart. And I'm sure you don't need any convincing of this, but why on earth would we think that the managers and staff of a health service have all the knowledge and wisdom and the patients and carers don't? It just seems completely potty to me. I worked over a 10-year period involving service users and carers. And we involved people who'd run businesses, who knew more about running a large organisation than the chief executive did, or the executive team. We had people who knew about finance and knew as much, if not more, than the finance director knew. We had people who'd been nurses, teachers, designers, architects, project managers, people with a whole wide range of knowledge and experience and skills. And if you're going to build a new organisation like Mersey Care was, we needed to, and other people, I think, need to engage all that knowledge, all that skills. It doesn't just rest with one group of people. So what did we do? Whoops. Better. Okay. So back in 2001, which seems an awfully long time ago now, when Mersey Care was established, the board took a view that and recognise that service users and carers had the right to participate in all of the decisions that affected their lives, and I underline that. It was a right. And they backed it up with resources, including myself, Director Service Users and Carers, basically to actually make that happen, to implement the change. And I think it's very important, again, moving forward perhaps, that this was actually a board-led initiative. It had the backing of the board. So I never argued with our 4,500 staff about whether it was a good idea or not. The only issue we ever talked about was, well, how do we do this? What's the best way of doing it? But doing it was never on the agenda. There was a board-level commitment, there was leadership, and I worked through a network of people in all the different services. And it's very interesting. I had people leading participation in the learning disability services, in the drug and alcohol service, in the mental health services, the older people services, and so on, because I'm not an expert in all of those, and they could work better about how to engage and involve those people. And it's very interesting that professional groups got on board. They wanted to get in on the act. So the psychiatrists signed up to getting involved in the psychologists signed up, the OTs signed up. And in a sense, we managed to get, in a sense, that bit of oomph, that kind of engagement of people to try and move this agenda forward in a kind of strategic way. So in a sense, I was leading a whole team of people to try and get participation throughout the whole of the organisation. We did something which, again, I don't know if that happens over here or not, is we offered payment to service users and carers who wanted to get involved in the work of the Trust. We thought it was really important to recognise and value their contribution. Initially it was £10 an hour, and then it went up to £12 an hour. And I think that is important because it's saying that your knowledge and experience is equally valuable to staff. When we're sitting round a table trying to move this organisation forward, then it doesn't seem fair to me that some people are paid to be there and other people aren't paid to be there. Let's recognise and value everybody's contribution. So what did people do? Try this is a bit slower than I am. It'll probably go on to about 10. You're laughing, it's right. I haven't got 10 slides. You're safe. It's not going to go through all of them. Right. Okay. So basically, what we did, in essence, at any time, and that people changed over time, we had about 250 people who said they actively wanted to participate in the development of the organisation, and that included older people. And it was important, I think, that they set the agenda, in a sense, of the kind of things that they wanted to get involved in. They wanted to get involved in the recruitment of staff. That was top of the list, really. And so we trained and supported people to get involved in the recruitment of staff. And over the time I was there, they were involved in over 2,500 appointments. There was quite a lot of turnover of staff over that sort of 10 years. And they were involved as equals in the appointment of staff. And again, I think that's really important because often people who use services and carers aren't looking for the same kind of things that organisations are looking for. Yes, I want somebody who's competent as a doctor and has got the technical skills as a nurse, but actually I want somebody who's got empathy, who's got understanding. And those kind of qualities, again, are terribly important. So we had a team of people getting involved in the recruitment of staff. They wanted to get involved in the induction of staff. Again, an important message on your first day working for Mersey Care Trust. There would be a session with service users and carers talking about what was important to them and what kind of organisation we were trying to develop. It's a powerful message about what the organisation was about. They wanted to get involved in incident reviews, which was interesting, when things go wrong. And inevitably in large organisations, things do go wrong. So people, and including older people, were trained and supported to get involved as equals in incident reviews. And I think that kind of thing is really important, because it's opening an organisation up to scrutiny, that things aren't going to be shuffled under the carpet. And in a sense that it gives more confidence when something terrible has happened, as sometimes does happen in mental health services. We sometimes have murders, serious incidents, you know, suicides and so on, that these kind of things are open to scrutiny. And they wanted to get involved in research as well, and I'll perhaps come back to that in a moment. But in essence, they were setting the agenda as to the kind of things that they wanted to get involved in. And over the course of time, we would send out adverts to the people, the 250 people on the mailing list, saying, are you interested in getting involved in this? Once a month, are you interested in getting involved in that? So people had a whole wide choice as to the kinds of things that they might want to get involved in, and that they generated the kinds of areas that they wanted to get involved in. In terms of older people particularly, if I can find where I am on myself, again, there were, in a sense, a whole range of work went on, working with older people. One of the things I think was kind of quite interesting is that older people are quite often kind of assessed to death about the kind of level of functioning. And in a sense, we try to turn that around to more of a human rights-based kind of assessment, and the kind of issues that were important to older people coming into hospital. So, for example, Article 8, Human Rights Act, right to family life. I mean, when you come into hospital, you want to see your children, your grandchildren, and so on. But do you really want to bring small grandchildren onto an acute psychiatric ward for older people? It's very difficult. So we created, with the help from Bernardo's, we created family rooms where older people could see their grandchildren in a lovely room, you know, in a homely environment that looks like your lounge or mine. Kind of often quite kind of simple kind of things around. I don't know what's kind of important to people. Well, having family contact. I've got a sister in Australia, and so for an older person, being able to Skype a sister in Australia, or whatever it might be, that actually these are the kind of the human rights, are quite basic kind of things that very often the health service just doesn't pay attention to, and that we can actually turn things around and be a much more human rights-based organisation. So in a sense, the people who use the services were setting the agenda. And every month we'd send out a pack of adverts about the kinds of new opportunities that were available. Right, okay, where am I? She said elderly and confused. Okay, yeah, we had the Shaw group. Oh, no, I haven't. Okay, I'll just go back one, sorry. Can I go back one? This is slower than I am. Okay, right. Okay. We had I mentioned about people wanting to get involved in research, and we had the service user research and evaluation group, which actually moved on to involve service users and carers. And so they were trained in research and evaluation skills, and I've got a copy of a report here that I can show people. And they were looking at, okay, what difference does participating in decisions actually make? And I've just got the latest, the last survey that I've got. It's from 2011, and they surveyed managers and staff at one level, and they also surveyed service users and carers about what their experience of participating in decision making in the trust had been. The managers. Interesting, 96% felt that the participation of service users and carers had positively affected them as a person, that 68% it had changed their attitude, 74% it had changed their practices, and 82% of them were personally responsible for enabling the participation of service users and carers. So over that 10-year period, I think, since we'd started, we had got that cultural shift that involving service users and carers was in the culture of the organisation. What difference did it make for the people who were getting involved, the service users and carers who were getting involved in the work of the Trust? 94% of them said it had made a difference, a positive difference for them as a person. 61% said they were more involved in care and treatment than 3 years ago. And 78% of service users and 79% of carers said participation had had a positive impact on their mental health recovery and well-being. So it actually changes the nature of the organisation and how it does its business, but it also has a positive health impact as well. And in many ways, over that 10-year period, we'd managed to get a cultural shift and getting it into the culture of the organisation. I wanted just to finish up by saying, as I say, we didn't get it all right. I'm sure over that period of time, lots to learn from from the experience at Mersey Care too. But I do think there is mileage in health organisations taking a much more positive attitude towards their responsibilities around human rights and their obligations to protect and promote human rights within organisations. I don't think that's particularly well understood in many NHS organisations in England. I'm not quite sure what the situation is here. Participation of older people, essential. It's a great way of doing things. And I think we had about a third of the people who were being involved in Mersey Care were people like myself of older years. The evidence is limited in this. The Shaw surveys, which we had done every 3 years, I think showed that level of participation can make a difference not only to the quality of the health services, the mental health services that we were providing in Mersey Care and the culture of the organisations, but can also make a difference to health outcomes. And I think that's really important, as it may persuade health organisations which currently show little regard for their positive obligations to protect and promote human rights to actually take the involvement of service users and carers much more seriously. It's a human right. I've talked a little bit about how human rights worked in one place close to home for me, and I look forward to hearing more today about how it works for you. Thank you.